Hello all, today we are evaluating a small field of view Cbct of a 35-year-old female who presented with a suspected pathology in the left posterior mandible. Starting with the cross-sectional view, this is a cross-sectional view wherein on the top left side you see a reference axial image. Here this is a reconstructed panoramic image and these are the cross-sectional sections of the same patient. Starting with the cross-sectional view, we immediately see a well-defined corticated expansile radiolucency in the posterior mandible on the left side. It's quite extensive. It is seen extending from the distal aspect of the mesial root of 3-7 right up to the anterior border of the ramus. Superiorly, what you see is it is seen extending from the alveolar crest, and inferiorly it is seen involving the superior cortex of the inferior alveolar nerve canal. Note that the lesion is seen encircling the crown of the impacted 3/8. We also see some significant cortical changes, that is thinning of the lingual cortex. To appreciate the cortical expansion in the buccolingual extent, we will evaluate the axial section. On the top left side, we see a coronal reference image, and these are the axial sections of the same patient. In the axial section, what we see is the thinning of the lingual cortex, and occasionally you appreciate that there is erosion of the lingual cortex. You can measure the lesion. Buccolingual extent can be measured in the axial section. Then going towards the coronal, the sagittal section of the patient. This is an axial reference image of the same patient, and this is a sagittal section wherein you can measure the lesion from the superior aspect to the inferior aspect. It is also here in this sagittal section, you can see that it has caused significant resorption of the distal root of 3-7 up to the middle third region, and it has also initiated the resorption in the mesial root of 3-7. So considering the radiographic features, a radiographic diagnosis of a dentigerous cyst would be given to this case, and we would see here in this a three-dimensional image wherein you can see this radiolucency encircling the crown, and it is involving the inferior alveolar nerve canal, the superior cortex.